Tonight on KQED Newsroom, more than 40 million Americans are out of work. We'll hear from a former presidential candidate tapped to lead California's economic recovery. Also, the pandemic has hit the Navajo Nation hard. We'll connect with a doctor about the Bay Area team working to save lives in Arizona. And making the case to invest in cities, not abandon them after the pandemic. Hello and welcome to KQED Newsroom. I'm Priya David Clemens. It is week 11 of sheltering in place in Northern California. As of this week, the U.S. has had more than 100,000 coronavirus-related deaths. That's the population of Boulder, Colorado, or closer to home, Burbank, California. The disease is still roaming the Golden State, with infections now topping the same number, 100,000 in California. Even as the state's caseload increases, Governor Gavin Newsom is easing restrictions on some businesses. Retailers can now reopen for in-person shopping under strict guidelines and with approval from the county's health department. But with millions out of work and many businesses still shuttered, California faces a daunting road to economic recovery. Joining me now by Skype is Tom Styer, a billionaire investor and a former 2020 Democratic presidential candidate, now the co-chair of Governor Newsom's Task Force on Business and Jobs Recovery. Mr. Steyer, thank you for joining us.
Priya, it's great to be with you today.
You know, I need to ask you, as a former presidential candidate, what is it like for you to currently be witnessing the nation's unrest and pain?
I feel terribly sad, Priya, watching what's happened in Minnesota, the murder of a black man in police custody in Minnesota. I feel immense shared grief with the people, particularly the African-American people, for whom this is the last incident in centuries of discrimination, injustice, and murder. This kind of incident, this open wound in the American psyche, calls out for leadership, calls out for a president healing the wound, talking to the family, addressing the need to reform racial injustice along with economic and environmental injustice. This is a ton of what I talked about as a presidential candidate. It's at the heart of American society, and it's at the heart of what people are upset about today and what I'm upset about, and which I think we all feel must be addressed directly, explicitly, talking about race in a way that I tried to in my campaign, and acknowledging the injustices, the structural injustice, and also the long contributions of the African Americans, centuries of contributions by the African American community, including their continued moral leadership in this country, which has gone on for much more than generations, but literally centuries.
Can you talk us through the equity lens of economic recovery in California and the specific actions you're recommending to the governor to make sure that California tomorrow is a better place?
Well, it's in the mission statement of our task force that we are going to work for a more equitable and just California. It specifically says that in the front of our minds are going to be the underserved communities, the Black and brown communities, who are paying a disproportionate cost in terms of health and a disproportionate cost in terms of job loss and economic suffering from the rest of society, that we're going to keep those communities in the front of our mind. So I'll give you an example. Where testing sites are. We must have testing sites in the places where people are most likely to catch the coronavirus. Those tend to be where they're essential workers, which tend to be Black and brown people.
Let's talk about the possibility of jobs in construction or infrastructure, similar to what happened federally with the New Deal. Is that something that California could look at doing now?
Absolutely. Look, Governor Newsom said in his revised budget that he was studying how to do an infrastructure program in California. That is absolutely in the front of his mind. And in doing so, we would, of course, create hundreds of thousands of jobs around California, and it will be incumbent on the administration, and I know that Governor Newsom takes this incredibly seriously, to make sure that the people in Black and brown communities are overrepresented as we try to rebuild jobs, rebuild the labor force. Yes, that is something where it will be incumbent on us to take race and economic disadvantage into account as we create jobs, as we do retraining and upskilling. That is something we have to focus on, and the governor is totally focused on doing.
What's the biggest obstacle that California faces in its economic recovery?
Well, I think the issue is going to be, Priya, whether as we reopen, there is enough demand to buy all the services that California can produce. And that's why I think it's going to be important for government to take this opportunity to rebuild a better California, to understand that we're not trying to get back to January of 2020, that in fact, we can end up with a more just and equitable California, a more sustainable and resilient California, more productive, better paid people, more justly paid people. And we will win by having the most productive workforce in the world, and you use the kind of information technology that we lead the world in to make our people better paid and to compete with anybody anywhere.
You have said that we shouldn't make the same mistakes that we made following the Great Recession, in which a lot of the relief money went to big businesses. What specific equity actions has your task force presented to the governor so far?
I break this down into short-term and long-term. Short-term, we need to make sure we're meeting the needs of the families of California who are hurting the most. And that includes taking care of their healthcare needs. We have millions of hungry people in our state. It is absolutely critical, and Governor Newsom is on this, very intensively to make sure that people are being fed. Longer term, we need programs about creating jobs, getting them back to work, making sure that the education system reaches them and enables them to reach their potential. So we have both a short-term specific need to meet needs today and a longer-term goal of creating a structure that addresses racial, economic, and environmental inequality across our state.
I know you've only been meeting for about a month, but time is obviously of the essence here. Have you presented the governor with any specific action items?
Absolutely. I mean, look, we advise him on all of the business decisions he's making. So the protocols for opening up a retail store, he is getting information from some of the 15 labor leaders who are on our task force in making sure that those protocols protect the health and safety of workers. He's getting advice from people who run thousands of retail stores around the world about what's practical to do, about what can effectively be done so that, in fact, it will work for the working people and for the customers. So we're doing that right now as he considers what kind of infrastructure program to propose. We are giving him input on the different things that business can see will, in fact, produce jobs, produce productivity, make us more competitive, make us more equitable and sustainable. That is something that is going on a daily basis. We're not trying to produce a nice, thick book to give to the governor in 6 months. We are working to try and advise him on day-to-day decisions, both for the immediate term, doing lots of research for him on a daily basis to come back so he has the best informed decisions, and long-term for a plan to structure a better California for the future.
Mr. Styer, before I let you go, I need to ask you a question that is going to seem indelicate. You're a wealthy white man. What makes you care so much about equity in the state and the nation?
Well, I think I'm still a human being, Priya. And my heart goes out to other human beings because I can see myself and my family in them. And so, one of the most moving experiences I've had is my partner, Kat Taylor, and I have been associated with California Food for California Kids. And seeing kids who need free and reduced lunch eat a healthy lunch and a sunny day outdoors in California is one of the most moving and meaningful experiences of my life. And, that is what drives me is I can see in an 8-year-old, I'm picturing him right now, down in San Isidro with big ears sticking out, with a huge smile on his face, eating a fish taco. That is incredibly meaningful to me.
Mr. Styer, thank you so much. Tom Styer, Governor's Task Force on Business and Jobs Recovery.
Priya, nice to talk to you.
Straddling Arizona, New Mexico, and Utah, Navajo Nation now has the highest rate of infection per capita in the United States. The nation, which is roughly the size of West Virginia, lacks comprehensive health care, and only 60% of all residents have running water. Residents have been wearing masks for 6 weeks and abiding by 57-hour weekend lockdowns. Since late April, teams of doctors and nurses from UCSF have been traveling to the region to help this vulnerable community. Joining me now is Dr. Sriram Sundar, an associate professor of medicine at UCSF who has treated hundreds of COVID-19 patients in Navajo Nation. He joins us by Skype from Oakland. Dr. Sundar, thank you so much for being with us.
Thanks so much for having me.
Now, you've been going out to Navajo Nation since 2015, but this was a special trip to assist with the pandemic surge response. Why is there such a high rate of infection there?
Well, there's several reasons why. I think when you talk about the history of Navajo Nation is a history of neglect of Native Americans in the United States. And so you have genocide, you have broken treaties, and then you have a health system that is underfunded. So a third of the rate per capita that the Indian Health Service, which takes care of the Navajo population, is funded only 1/3 of what the VA is funded and Medicare. And then you have, as you mentioned in your opening, a lack of electricity or running water for a third of the population. And so when you talk about shelter in place, which might be an inconvenience for me and you, it's an impossibility for many Navajo folks. And then going into this beautiful, expansive definition of family that a lot of Navajo communities have, where several generations live in close quarters, it's really hard if one person's positive. You see these family clusters that we're seeing. And then lastly, I'll say that, there is higher rates of diabetes or obesity, several fold compared to the general population. But when you talk about 27,000 square miles across Navajo Nation, the size of West Virginia, there's actually only 13 grocery stores, and West Virginia has 162 in comparison. So if you're talking about, comorbidities like diabetes or obesity, being in a food desert and having mostly access to processed foods is one of those major risk factors that we're seeing.
As a doctor, what have you learned about COVID-19 from treating hundreds of patients?
I mean, in Navajo Nation, it is very humbling in a lot of ways, because what I know as a doctor, I've seen so many types of pneumonias, and I didn't see enough patients in San Francisco that when I went over to Navajo Nation, generally you start to get good at what can I predict? This patient coming into the emergency room, I see them and I can predict their course. And I think actually in COVID-19, sometimes people that I thought would do exceptionally well start to go up in their oxygen, and then we end up intubating them and they get flown out to Flagstaff or Albuquerque or Phoenix. And then some people actually peak at that oxygen level of high flow oxygen, and you're really thinking that you're going to have to intubate them, and they turn around and turn the corner. So it's actually one of these very humbling diseases. And from our standpoint, we don't have a lot of therapies. We're starting to get remdesivir. And so it's really supportive care with oxygen, and really I felt like a cheerleader for a lot of our patients, just trying to get them through and give them hope that they would survive.
Dr. Shama Sundar, we're certainly seeing across the nation that COVID-19 has laid bare many of the inequities across our country. And that is really seen in Navajo Nation, which is a prime example of how poorer people are suffering much worse than people in wealthier areas. Can you speak to us about this inequity and what you think can be done to change that?
Yeah, that's absolutely true. I think I've worked, as you said, in Navajo Nation since 2015, and a lot of the conversations that we're having now about rationing care, being understaffed, to take care of patients, all of that existed long before people were paying attention to Navajo Nation. And I think that across the United States, if you're paying attention, whether it's the Black population in Chicago and New Orleans or Native Americans. For example, Native Americans only make up 11% of the New Mexico population, but are a third of the coronavirus cases. And in Chicago, 30% of Black folks live in Chicago, but they make up 56% of the deaths. And so these inequities are so clear. And those of us that are worked in the health system, it's very apparent. But I think what we have to do as Americans is pay attention to our history. And I think in the United States, whether you're talking about George Floyd and some of the protests in Minneapolis, or you're talking about the genocide, the history of broken treaties in Navajo Nation, this has relevance to this moment. And if COVID is going to be a portal to a more just America, we have to look in the mirror at ourselves. So when there's vaccinations, when there's access to drugs, how do we place our vulnerable communities as the first ones that have access to? But in historically and in COVID, they've actually been the last ones.
And is there a story you can share with us that illustrates the Navajo community, their resilience, or perhaps the challenges they face?
Sure. Last week, I was in Chinle, Arizona, so it's right in the heart of the Navajo Nation, and I was taking care of a woman who's probably close to 60 years old, and she was very sick. She was on high flow oxygen, and she was telling me that for 2 weeks before she came into the hospital, she was very short of breath, was having fevers and chills, and she stayed in her pickup truck. She laid down a blanket and she stayed in her pickup truck with fevers and chills in order to not expose her 85-year-old parents. And so in Navajo Nation, the level of kinship and the level of family commitment is so beautiful, and it's just a cornerstone of who they are as a people. And so I saw this woman who's a very resilient, highly beautiful person, and had just suffered for 2 weeks before she came into the hospital in order to protect her elders. And that's what we're seeing over and over again, that the elders are so incredibly important to the community. And I hear over and over again that despite this difficult time, there's a Navajo saying of, "We will walk in beauty once again." And so that is what we hear from a lot of our patients, even through their struggle and through their pain. I left taking care of her, and one of my colleagues was taking care of her the next week, and he said, without an unsolicited comment that came from her, was that Dr. Shri had made me believe that I will get through this. And now she's sharing a room with another patient, and she said, I'm doing the same for my patient, my next door neighbor, and in the hospital. And so she was down to 2 liters. She was getting close to discharge. And like I mentioned, she was somebody that could very easily have gotten intubated and flown out to another part of the state. And instead, she kind of turned the corner, and she's going to be going home soon.
It must feel great to see the work that you're doing having such effect. Dr. Sriram Shama Sundar, thank you so much for your time and for your help out there.
Thanks so much for having me.
Working from home has become the new norm for many in the age of coronavirus. Some tech companies like Twitter and Square are allowing their employees to work from home indefinitely. And as the ability to work away from the office becomes more robust, many will have different choices about where to live. But will cities continue to thrive in this new reality, or will they empty out, driven in part by fears of another outbreak? We're starting a new closing segment tonight in which we'll look at the systemic problems the pandemic is revealing and the opportunities for change. This evening, we focus on the future of cities. Joining me now by Skype is Molly Turner, a lecturer at the Haas School of Business at UC Berkeley and co-host of the Technopolis podcast. Molly, thanks so much for joining us.
Happy to be here.
Let's start with a case study. Let's look at Facebook. They're headquartered in Menlo Park. They have offices in San Francisco, and they've said that in the next decade, half of their workforce could be working remotely. How much will that impact those two cities, which have relied on their revenue, their tax revenue, and their ancillary spending?
So I think there's a real difference between an employer giving employees the opportunity to work remotely and employees actually wanting to do that every day of the week. I think a lot of the surveys that have been coming out have showed us that employees do want flexibility, but that doesn't mean they want to work remotely forever. They still value face-to-face interaction. And of course, there are a lot of jobs that cannot be done remotely, and we've seen the impact on those jobs through the shelter in place. So while some small percentage of workers may choose to work remotely and in fact leave the Bay Area, I don't think it's going to have a dramatic effect on Silicon Valley's economy.
Interesting. What about the need for people to feel safe in cities? Do people want to be living clustered together, congregating, when it seems like disease can be spread so much more easily when you are close together with other people? Will cities have to make a specific marketing appeal to say, we're safe, come live here, come work here?
Look, there are plenty of big cities across the world that have managed to contain this pandemic. Living in a big city does not have to be this dangerous. And in fact, cities have persisted through pandemics for centuries. Living in cities has always had high costs, high rent, noise, contagion, congestion, but people continue to choose to live in cities, not just because that's where jobs and economic opportunity are, but because that's where community is, diversity, culture, and of course, living in cities is better for our planet when we choose to live in density with each other, use resources efficiently, and preserve agricultural and open land.
Interesting. The pandemic has upended not only our daily lives, but it's giving us an opportunity to look at our social systems. What are the most innovative ideas that are being floated right now when it comes to managing population growth and urban density?
So there's some really interesting silver linings to this. First of all, we've seen amazing regional collaboration amongst the Bay Area counties, something that urban planners like me have been wanting for years. If only we could collaborate regionally like that on a regional transportation system to increase public transit around the entire region. Housing is another thing that we need more regional collaboration on. It's been really interesting to see a lot of cities that have resisted formalizing homeless tent encampments like San Francisco actually really invest in that right now and so quickly. It's been really interesting to see cities that have really been afraid to take space away from cars and allocate that to bicycles and pedestrians do that so quickly. Look at Oakland dedicating a huge number of streets to slow streets and creating this massive trend across U.S. cities. There are some really inspiring big decisions that city leaders can be making right now.
Is there an equity lens we can be looking at this through as people move to perhaps smaller cities or other places across the country? What opportunities arise within the city?
Absolutely. I think as some percentage of workers choose to leave the Bay Area, choose to work remotely, or may have lost their jobs and therefore choose to leave the Bay Area, that may actually be pretty good for U.S. cities, because right now superstar cities like San Francisco have the disproportionate share of tech and knowledge workers. And if those jobs are distributed across more cities, that could not only help second and third tier cities across the country, but that could actually leave room for more people who want to and need to live in the Bay Area.
And Molly, what institutional changes need to be put into the works right now during this window of potential opportunity in order for there to be a better city tomorrow?
We need to be able to make some really big decisions that we've been dragging our feet on all along. We already know what we need to do to make the Bay Area more affordable, more easy to get around, and more equitable. That's not rocket science. We know what we need to do. We've just dragged our feet making the big decisions. And that means regional collaboration, investing in housing development, more affordable housing development, and housing development across the entire region, investing in a regional transportation network. These are all things that we have plans for, but we just need to take this opportunity to actually implement them.
What do you think are the odds that these changes will take place?
I'm really hopeful because I'm already seeing our city leaders across the region make these big decisions. Just look at how quickly the city of Oakland was able to open a huge network of slow streets. We can move quickly and make decisions if we want to. So I'd say 100% likelihood that we as a region can make these decisions.
Where do you see the obstacles?
You know, we are politically divided in this region just as we are in the nation. And I think we need to find opportunities of shared values and focus on outcomes. And I see that happening as we make these tough decisions city by city and region by region. I know it can be done. We have to put the politics aside and figure out how can we achieve these shared goals that we have.
Molly, are there cities around the world that you would point to that you'd say we could emulate to handle some of these problems that we have, like congestion or housing shortages?
Sure. So some Northern European cities have been really inspiring when it comes to some of the big transportation decisions we've been making lately. I believe Vilnius, Lithuania was one of the first cities to open up its streets for restaurants and other small businesses to be able to continue business outside where it's safer right now. And that's something that we're seeing U.S. cities across the country start to adopt as a policy. A lot of Denmark and Sweden and Norway have really great active transportation first policies where they prioritize and invest in infrastructure for bicycles and walking over private vehicles. That's something that transportation planners have been looking at for years. And we're seeing them lead the way again right now. So there are plenty of cities that have great examples for us to follow.
So Molly, great ideas, but let's talk about where the rubber hits the road. We are in a massive deficit in this state, right? $54 billion in deficit, and the federal picture isn't looking great either. What real likelihood is there of funding these projects and these ideas?
Well, I think first of all, we can prioritize projects that are not as expensive. Creating bicycle and pedestrian infrastructure is a pretty affordable transportation investment, a lot more than building another train right now. Second of all, I think in California and in the Bay Area, we really need to rethink our tax structure. Right now, with property taxes frozen, we are reliant on taxing income, which is really difficult during an economic downturn like this. So, for example, Prop 13 reform is going to be on the ballot this November, and we as a state have an opportunity to rethink how we want to tax commercial real estate, and that could be a huge boon, particularly for school budgets right now. So there's going to be a really interesting debate about whether that is a reasonable solution during this economic downturn.
Molly Turner with UC Berkeley, thank you so much.
Thank you.
As always, you can find more of our coverage at kqed.org/KQED Newsroom. I'm Priya David Clemens. You can reach me through my social media handle, Priya D. Clemens. Thank you for watching. Stay safe.